One of the challenges with changing lifestyles is providing the right type of incentive for the patient. And you talked about a reward system that you'd set up. Could you explain that a little bit more thoroughly? In fact, it's interesting to me because on April 25th, I'm going to be conducting a Minnesota Healthcare Roundtable on patient engagement. And how do we get patients to comply, an issue of compliance with the recommendations of their doctors, and how do we help them take more responsibility for their health?
There's a science now around rewards and how you use those rewards and how you engage patients effectively. I mean, there is the human mind, and how you interface with that is not logical. We don't make logical decisions very often. We make emotional decisions. How do you engage emotionally somebody to engage? I had the privilege of looking at the South Central Alaska Foundation. They won the Balcom-Eldridge Award for transformation. They had the worst diabetic management of any place in the country, and now they have the best. And they fundamentally began to ask themselves the question, you know, how do I take a patient who isn't a dart, right, who's a bird, who's going to fly between the time you give them the medication prescription and they actually take it? How do you understand how to get a community wrapped around that patient? How do you get a family wrapped around that patient? How do you get the support community wrapped around that patient in a way that you can begin to affect change, right? Mm-hmm. Great example of that in St. Johnsbury, Vermont, and also in Alaska. And I know that Dodge County is working on that as well in Minnesota. It's very exciting. But we now begin to understand, and the science of that is really important. You know, I mean, if you give a few $100s off, and you do it once a year, not many people will do that, because even though that's a significant amount, if you do a few $100s off and then you give gratification every week, every 2 weeks, and there's a loop and there's a feedback and you get buy-in and you begin to get change, right? Those are the kinds of things that I think employers and others are beginning to look at.
Good, thank you. Any of the panelists have a question for Paul before we move on? Okay, Manny, you're going to have the floor and bring us up to date on the Minnesota Healthcare Exchange.
Delighted to do so. So let me start with some base level setting about what an exchange is. Structurally, conceptually, an exchange is a mediated marketplace by which consumers can do side-by-side comparisons between health insurers to make a decision about which product is best for them. Minnesota's been thinking about doing a health insurance exchange since at least 2008. In fact, the very first governor who proposed an exchange bill in Minnesota was Governor Tim Pawlenty. That bill was designed to serve the needs of small business owners primarily. Since that time, the concept of exchanges have evolved, have morphed, and in the Affordable Care Act, a concept was embedded in that act that states had an option. They could create this online marketplace, these media marketplaces known as exchanges, or the federal government could do one for them. Our governor, Governor Dayton, concluded that for various reasons, we want to run our own exchange. So he directed, at that time, the Department of Commerce to begin the work of designing and planning for the implementation of the exchange. Now, you may recall that prior to last November, he was dealing with a legislature that didn't necessarily agree that implementation of the Affordable Care Act was a great idea. And there were also a fair number of people that believed that, you know, the Supreme Court would say the whole thing was a mess. So for a fair number of months, the work on the exchange had to occur primarily without the input of legislators. Well, after June and after last November, that's no longer an option. Our legislature is going to be engaged and is involved in that dialogue. And I'm going to talk about some of the issues they will grapple with, issues on which you are likely going to be some key inputs into their thinking on how they want to resolve those issues. But before we get to those issues, let me talk about who the exchange is intended to serve. Based on our most recent projections, we expect 1.3 million Minnesotans are going to eventually use the services of the exchange. That's about 1 out of 5 of us, folks. And of that 1.3 million Minnesotans, they will be composed in the following sort of categories. Roughly 700,000 of them will be enrolled in Medicaid. And you're going, well, wait a minute, Manny, I thought the exchange was a private commercial enterprise that is all about buying insurance products. It's actually that plus. The exchange becomes a place by which individuals and small employers can find access and enroll in both public and private insurance programs. The paradigm shift in this model moves from are you eligible for insurance to what kind of insurance program are you eligible for. So it becomes are you eligible at all to more which program are you eligible for. So our exchange is going to be used to be our Department of Human Services eligibility and enrollment platform for Medicaid. So hence, roughly 700,000 people in Medicaid. Another 400,000 or so individuals will be purchasing their insurance through the exchange. And the exchange also is the exclusive place by which those individuals can obtain a tax credit to help defray the cost of that insurance product. So up to 400% of the federal poverty level, an individual, and that's roughly $45,000 for an individual or about 90 grand for a family of 4, you can come to the exchange and get some form of tax credit to help offset the cost of buying the insurance product. The last category of potential customers for the exchange are roughly 200,000 or so small employers and their employees. And we define in Minnesota a small employer as 50 or less employees. So those folks will have an option to come to this immediate marketplace to buy insurance from it, to, in the case of employers, make a decision about whether or not you move to a defined contribution plan, which is a plan where the employer just pays a set sum, but the employee gets to pick which product they want to buy. Those are all going to be new options for employers, individuals, to purchase insurance products. Now, what do they see when they come to the exchange? Well, they're going to put in data about their income if they wanted to determine whether they're eligible for a subsidy. They're going to put probably information about, which is their primary care provider, because that might filter down the number of plans that have that particular provider in network. They might put in some information about sort of, depending on the level of granularity the exchange gets into, potential benefits or conditions or even medication that they're interested in seeing covered by their plan. Once they do that, they would have then a report response that articulates here are the plans that meet your criteria. They would then have an ability to purchase through the exchange, be enrolled, and have their coverage confirmed. What are the kind of issues that, policy issues that the legislature is going to have to wrestle with in making a decision about how to implement the exchange? Well, one of the first ones was, are we going to do it, or is the federal government going to do it? Our governor and the majority in the legislature have concluded we do not want to let the federal government run this marketplace, which is going to impact 1 out of 5 of us. We would rather be in control of our marketplace here in Minnesota. Having said that, there are federal standards we have to comply with, but we're going to be in the position of actually determining how those standards are going to be implemented in our state. So that was the first question, feds or state. We made a decision that we want to run a state-based exchange. Now, by the way, I say that based on the assumption that this bill will pass. Understanding the legislative process is is a interesting process that would seem to be a reasonable expectation. And if you're curious in tracking the bill, it's Senate File 1 on the Senate side and House File 5 on the House side. The second kind of question that policymakers have to make was, what kind of entity should the exchange be? Because the options are, it can be a state agency, and we know what those look like. I work for one. It can be a fully independent nonprofit, or it can be that wonderful creature in between known as a public-private hybrid. And that is a spectrum. You can have elements along the agency or nonprofit line in which a hybrid will sit. The current proposal under the bill is a public-private hybrid. A big question that was debated last night in the Senate State and Local Government was, what kind of conflict of interest provisions should apply to the board members of the exchange? They range from some states which say, by the way, the only requirement under federal law is the majority of the board members cannot have a conflict of interest. They range from, in some states, saying no conflict of interest is allowable at all, to some states saying you can have a conflict of interest, you must just recuse yourself, but you can't be a majority. Minnesota, our initial draft starts with the premise that you have to have a 1-year cooling off period before you can be a board member if you have a pecuniary interest in the exchange. For you guys, I think the question I would have for you is, some people have argued that provision would actually bar practicing physicians from serving as board members. That's not the intent, but I can understand the argument. Other policy questions to be resolved this session. What is the exchange's role in the marketplace? Now, speaking on behalf of a guy who works for a market regulator, we view the exchange, and I think this is the shared position by just about everyone, as a marketplace participant. They're not intended to be another regulatory arm. They're not intended to be another government bureaucracy that dictates another set of rules. Having said that, I'm pretty sure that some of my colleagues on the commercial side may they may take some exception to my characterization that standards aren't rules, but that gets into philosophical conversations that are probably best resolved over a glass of wine or something. The exchange has a fundamental policy question on whether or not it's going to be an active purchaser or a facilitator in the marketplace. What does that mean? And we were having a dialogue a little bit about that before we started. Should the exchange be selective about which products it sells? Should it curate among all the products that it could conceivably sell on behalf of its consumers? The other argument is, no, the exchange should sell every single product that meets the minimum criteria. In this instance, the exchange board in the current draft was given the ability to make choices, so the ability to be a purchaser.